Oloflahia to Relief with Fale, warm Pacific greetings, and kia ora tātou. It's a pleasure to be here. Let's see if I can make this work. I'm going to change tack a little. Talk specifically about the Pacific, the region I know best. It's quite a different presentation from what you've heard before. I think Trevor obviously has presented a rather daunting prospect. I've continued that theme by suggesting perhaps that paradise may be under threat. The second point I want to make in this is that we feel a bit grumpy in the Pacific because we are actually subjected to and impacted by the negative impacts of the actions and decisions of other people. In other words, I want to focus on climate change. You see, the Pacific, whilst we don't have big urban areas that you've heard from Priya, our habitats, our homes, our ocean is just as critical and as important to us. This is about quality of life, not huge numbers of people that you might see elsewhere in the world. So I want to talk a little about the climate change impacts, particularly health impacts, and make some comments about health care facilities. I have a couple of slides at the end about the role that we play as the Pacific community. I want to acknowledge colleagues in the room, Paolo Vivili, Sunia Sokai and others who have contributed to this. This is the picture that I want to leave for my children and my grandchildren, and I'm sure yours too. We want to leave behind a clean, a pristine environment for them. Let me say that when I say we're grumpy, we're more than grumpy. There are people who continue to deny that climate change is a problem. I want to suggest to you that this is not the conversation anymore for anyone who's half informed about what's going on. For us, this is about a moral obligation. There's a moral imperative to act, especially by those in positions of influence and those who contribute the most to the harmful greenhouse gases. We think the Paris Agreement is a fantastic document, and we'd like to suggest to the IUHPE that you want to help us encourage your governments to honour the agreement in Paris and to implement that agreement and related agreements that have occurred since then. You see, climate change is not a theoretical and idle conversation for us. It's affecting lives and livelihoods in the Pacific as we speak. I would like to suggest that, in fact, climate change has a potential to cause an ecological disaster. I don't think I'm being dramatic here, and if you think again about the points that Trevor made, I think it's not an exaggeration that we may well be looking at a disaster of unprecedented proportions, at least from our perspective in the Pacific. I also would hope that you've gathered from my comments that we think this is an issue of social justice. People in the Pacific are facing the sharp end of the negative impacts of climate change, yet we contribute a minuscule amount to the harmful greenhouse gases, a minuscule amount. But we're the ones who are severely subjected to the harmful impacts of climate change. I want to suggest that for at least for some of our nations in the Pacific, the focus on health and the health impacts of climate change perhaps could be elevated up a bit further in the policy-making agenda of our governments. Naturally, people have been focusing on getting the voices heard at the global level, but I think we need to also start paying attention to the health impacts of climate change. For those who were at the presentation yesterday, as you know, I mentioned that climate change, of course, affects the entire range of determinants of health: the food we eat, the water we drink, the weather we experience, and it affects pretty much all dimensions of our lives and livelihoods. I describe climate change as an effect multiplier. By that I mean climate change does not, in fact, introduce new threats per se. I'll talk in a bit about water. Climate change aggravates, makes worse what already exists. And I use the example of water, where despite the pretty pictures that you might see about life in the islands, it's actually very hard to source water particularly for small outer atolls. And access to clean water in our region is problematic and varies from 20% of the population upwards. So access to water is a problem. And climate change and the impacts of climate change on water and water sources would obviously suggest to you that it will make things worse. The point in all of this, of course, is that preparedness is critical. So if you don't address water supply, if you don't address food security, if you don't address your environmental issues when there's not a cyclone around, then clearly you're going to expect to suffer the consequences of that. When people talk about climate change, people naturally think about cyclones and floods and dramatic pictures like this. And the media, of course, would often refer to sea level rise and islands going under. And of course these things are part and parcel of the climate change spectrum. But I want to suggest to you that for us in the Pacific, more subtle, less visible dimensions of climate change, like ocean acidification and other related issues like pollution, potentially has a much greater impact on the lives and livelihoods of our people. You see 80% of the protein for Pacific communities come from the sea. The Pacific Ocean is a big deal for us. Not only it supplies about 2/3 of the tuna that is consumed around the world, but it also supplies a large part of the sustenance of small communities in the Pacific. Just recently, the World Economic Forum put out a report, the World Global Risk Report, last year rather, and Vanuatu and Tonga are on top of that list. And in the top 10, we have Solomon Islands, PNG, and Fiji as being amongst the most at risk of the nations globally. What this means, of course, is high levels of societal vulnerabilities, and you will hear this on a fairly regular basis in respect of cyclones, floods, droughts, and whatnot around the region. This slide just outlines for you the economic impact of major events in the last decade. If I take you to Tropical Cyclone Pam in Vanuatu in 2015, Vanuatu lost 2/3 of its GDP. And if you look at, or close to $1 billion US dollars, if you look at Tropical Cyclone Ita in Tonga in 2018, more than 1/3 of the GDP stamps. As you can see, it can get rather depressing when people get back on their feet, when nations rebuild their infrastructure, re-energize their economies, and you get knocked back again, which is, I suppose, a part and parcel of living in the Pacific. But I want to say to you, rather than being despondent about some of all of this. Pacific communities are fairly resilient people. It's just rather difficult when you're faced with constant threats, particularly in relation to, as I say, activities of other people. These are fairly well known. Climate change impacts in small communities like ours, the vulnerability of small islands, of infrastructure, of services, of safety of people become paramount. The London School of Economics estimates that anywhere between 2 and 10 million people will be displaced as a result of climate change by 2050. And we, in the last few years, have been assisting the Fiji government to relocate villages up to higher ground as a result of threats from climate change. Relocating communities might sound simple in mechanical terms, but relocating your village, leaving behind what you know and familiar, is a big deal to families. What do you do with the dead who are buried? These kinds of issues come to the fore. But it is part and parcel of the current activities that we are engaged in the region. It's interesting to note that in the early days, some of the island leaders were referring to moving elsewhere, to moving out of the Pacific to Australia and New Zealand. I think if you pay attention to what they've been saying recently, President of RMI, for example, are now saying that moving elsewhere is the last resort, and that really the imperative is for leaders of our nations should do the right thing and act accordingly, because people rightly say that these are our homes, this is what we know, and we will only move, we will only relocate elsewhere if they don't have any other choices. I want to focus the presentation now on food and water, because they're very practical issues that manifest itself as we deal with climate change. But of course, you'll see from, or you'll know from other reports that climate change affects pretty much the whole dimension of life and livelihoods everywhere, I must say, but especially in the Pacific. And I'll also talk a little bit about health. This is a slide that I think summarizes the key issues of the impact of climate change on human health. If you look at the center, it talks about rising sea levels, rising temperatures, weather-related events, which has impact on things like water and food supply, environmental dimensions, air pollution and whatnot, and as you can pick up from that, on the outer dimensions are the impacts on human health. One of the things I made mention yesterday was my concern that we have a rather poor knowledge, inadequate understanding of the psychosocial dimensions of climate change, of people being shifted to new locations in our region. People are naturally concerned for their future, for their lives and their livelihoods, their families, and uncertainty about the future. So those of you aspiring researchers, particularly in the mental health space, here's a route that might keep you employed for the rest of your research career. Mm-hmm. Let me turn now to water. As you know, water is a major factor in human health, and I mentioned earlier on that in our region, less than half or about half of the populations have access to clean water, and getting clean water sources in our region is rather challenging, subject to contamination, saltwater intrusion, especially in low-lying atolls. And climate change, of course, is likely to make matters worse, as I mentioned earlier on. An increase in waterborne diseases is an example. Much of the childhood morbidity statistics that you see from our region are related to lack of access to clean water. And really, in our region, if you look at this compared to the rest of the world, access to clean water between 2000 and 2015, in fact, appears to have gone backwards. I must say, despite the rhetoric about how important water is, it's not actually high up on the list of funding priorities for development partners. We seem to be wanting to look at other things, but water and sanitation, these basic public health goods, don't appear to be very sexy for funding, and especially in our region. In 2016, we did some work with WHO, UNICEF, UN Habitat, basically confirmed what I've outlined, that we have indeed a problem with access to clean water. It varies considerably across the region. In parts of Papua New Guinea, less than 1 in 5 have access to clean water, and access appears to be stagnant or dropping. And children in particular are very vulnerable to the impacts of lack of clean water sanitation. Turn now to food. Climate change affects the entire food chain from production through to its end point. I'm told by experts in our organization that important cash crops in our region, like sugar, coffee, copra, production is expected to decline, and changing pest and disease patterns will continue to disrupt the regular supply of food in our region. See, food is important in the Pacific because the other big dimension in all of this for us is the dubious distinction of being the obesity capital of the world, and related to that, problems of NCDs, particularly diabetes. That's why food security is so central to the work we do with our members. I mentioned earlier on that 80% of the protein in Pacific communities come from the sea. Again, the work that we've done at SPC predicts that coastal fisheries harvest is going to decline by half. From a number of factors, overfishing, pollution, ocean acidification. And this is a big deal for us because the alternative, of course, would be for people to consume highly processed imported food. So whilst we might want to encourage people to catch and eat fresh fish, the reality might be it's difficult. And I made mention earlier on that ocean acidification, of course, is an important dimension in this. Dengue has always been around in the Pacific, but in the old days you used to get one strain that there might be an outbreak and then it'll settle down. But since 2012 and again in 2016 and 2017, we've had all 4 strains circulating in the Pacific. And pretty much dengue is constant. It's a constant threat in our part of the world. And of course, those of you who venture out to the Pacific every so often from New Zealand, dengue is a major issue. I want to turn now to healthcare facilities. This is a slide I showed some of you yesterday of the maternity ward in Tarawai and Kiribati. As you can see, it's a bit daunting to think that you might going to have a baby when the waves are crashing against the walls of the delivery unit. This is not my picture, someone else took it, but it rather portrays a stark image of what goes on in some of the places in the Pacific. For us, the health systems of small island states are pretty fragile. Most of the facilities are located on the coastal regions, and again, vulnerable and exposed to extreme weather events and at risk of damage during cyclones in particular, and floods. And many of the facilities in our region are not what you might regard as meeting adequate building codes. Small health systems, of course, have a lot to deal with, but it is important that this is introduced in terms of the policy developments in our region. And human resources for health and finances are always a challenge. Just in terms of what SBC is doing, we're a scientific technical organisation, and we've been providing support with information and technical advice to our leaders. I have to say that I'm impressed with the tenacity, consistency of the voices from the Pacific Island leaders about climate change. And I've called it Pacific Island small states and loud voices, because that's what needs to happen in terms of drawing world attention to a very real and very present risk to our region. And we are engaged in a number of technical, scientific activities in support of our member states. Mainly in terms of our contribution to the climate change agenda, we provide the scientific and technical advice and knowledge to partners, to leaders of our region for decision making. We assist communities with solutions on the ground in terms of access to clean water, for example, and a range of activities to try and reduce the risk, mitigate the risk, adapt activities in response to the effects of climate change. So it gives you a flavour of what we do in the organisation that I work for. So just to finish off, I think it's not an exaggeration to say that climate change is the most important threat to lives and livelihoods in the Pacific. And as I indicated earlier, I don't think it's an exaggeration to suggest that it is, unless the actions are taken, and several reports have come out to suggest that we need to act more decisively, that there is potentially an ecological, catastrophic ecological disaster, at least in our region. Climate change impacts pretty much all communities, but it's even more acute and pressing in small island developing states. Climate change is an effect multiplier, as I said. Food and water security are probably the most critical in our region, but no doubt both communicable and non-communicable diseases will get worse, especially vector-borne, waterborne diseases. We've suggested to Pacific governments that they need to pay attention to basic needs such as water and sanitation, food security, and health needs need to be better integrated into climate change policy and development plans in all of the island states. I do think there's a big responsibility on the global community in terms of encouraging action by appropriate folk. The global community needs to step up actions to limit the impacts of climate change on small island states. And I would just encourage you all who are members of IUHPE to talk to your government. Encourage them to do the right thing. After all, isn't this what collective action might be from a community practice such as IUHPE? Thank you very much.